Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. Today we'll be seeing about principles, purposes and drug forms. So as a nurses, when the doctor prescribes a medication to the patient, so we are the nurses going to look after the patient and care for the patient for 24 by 7, and in that care this also included, that is administration of the medications. So before administration of any medications we have to follow certain principles and the 10 rights of the medication, then only the proper medication will be administered to a proper patient. So this is following of the principles of nursing ethics, that is non-maleficence and beneficence. So whatever the medications we are going to administer to the patients, it has to give the benefit to the patient, and in the same way we should follow the nursing ethics of non-maleficence, that is we have to be very conscious in administering medications. In that cases we should avoid giving any harm to the patient. So after the session, the learners will be able to list out the purpose of medication administration, enumerate the uses of drugs, explain the principles of medication administration, list down the rights of medication administration, and describe the drug forms. Next is introduction. Medicine may be defined as a substance used to promote health, to prevent any disease, to diagnose, and to alleviate or cure the diseases. The safe and accurate administration of medication is one of the major responsibility of a nurse. So as a nurses, we must have a thorough knowledge of drugs that is being administered by the nurse. The fundamental rule of safe drug administration is never administer an unfamiliar medication. So for example, I am in the ward, so I am taking the handing over from the other nurse. So nurse have given me like administration of the atropine to some of the patient. So I should be conscious, because there is sometimes sound alike and look alike error can take place. So I have to cautiously check the prescription chart, and then consciously check the what the medication is, and then I have to correlate it. Then only I have to confirm that okay, this is the medication, this medication in this dose only I have to administer to the patient. So before administration of any drug, I should, as a nurses, I should have a thorough knowledge regarding the dose, route, frequency and functions of the drug. And in the same way, if I see that if any unfamiliar drug is there, I should not administer to the patient. Next is purpose of medication administration is, one is diagnostic purpose, to identify any diseases, we give any medication, then we will do the diagnostic purpose. Next is as a prophylaxis also we administer the drugs, that is for example heparin is administered in order to prevent the thrombosis, and or the antibiotics is being administered in order to prevent the infection. And in the same way for therapeutic purposes also this medication has been administered, that is to cure any diseases. So for example, if a patient is having any running cold or fever, so we administer the antipyretics. So if they are having pain means we are administering the analgesics. So in order to prevent any disease conditions also we used to administer the medications. Next is prevention, so used as a prophylaxis to prevent disease, example vaccines, fluoride that prevents the tooth decay, that is we use in the toothpastes. Next is as a diagnostic also we do it, that is establish the patient's disease of problem, example radio contrast dye or tuberculosis or the Mantox testing. Next was suppression. So suppression of any signs and symptoms we use to administer the medications, that is for example anti-cancer medications or antiviral drugs, in order to suppress the activity of those viruses and bacteria. Next is treatment process, to alleviate the symptoms for the patients with chronic disease, example anti-asthmatic drugs, and to cure any disease conditions also, that is for the complete eradication of disease we used to administer the medications, that is for example antibiotics or anti-helminths. Next is enhancement aspect of health, so to achieve the best state of health, example we take the multivitamins, for example A to Z, or minerals or calcium. So in order to prevent the hypocalcemia, we used to administer the calcium supplements. So in order to achieve the best status of our health also, we take the medications in our day to day life. So next is principles of medication administration. So principles includes 3 checks and 10 rights. So the 3 checks are: check when obtaining the container of medicines. So when I am taking the medications to administer, at that time I have to first check it. Next is check when removing the medicine from the container. So before taking from the container also, I have to check it whether this medicine is right as per the doctor's order. Next is check when replacing the container. So after the administration of medication also, we have to recheck it, that is whether the prescribed medication has been administered or not. So rights of medication administration. First is right patient. So the correct identification of the patient cannot be overemphasized. So this can be done by asking the client to mention his or her name. For example, I am going into the ward, I have to administer the dues or the medications. I will ask the patient, so what is your name? Then I will counter check it with their files, inpatient files. Then I'll come to know, okay, this is the confirmation, and as per the prescription the right patient has been approached. So next is right medication. So before administering any medicine, compare name on medication chart or medication order with that on the medication at least 3 times. Checking medications label and compare it with treatment chart. So I will see the medication, then I will compare it with the prescription chart that is being given by the doctor. In every patient's file there will be a prescription chart, and that prescription will be provided by the physician, and that will be signed by the physician, and in some hospitals even the counter sign is being done by other physicians. So this is the first rights of medication, that is right patient. So we have to first check the right patient by asking their name and checking with the file. Next is right medication, that is before administration of any medication we have to thrice check the medication. So we have seen that 3 checks that has to be done in order to prevent the discrepancy in the administration of the medications. Next is right time. So drug timing is very important, where some drugs like anti-tuberculosis must be given on empty stomach, and non-steroidal anti-inflammatory drugs must be given after meals. So we have to be very conscious in giving the medication. So once we give the medications in the right time only, it will have a proper absorption. So even we say no to the pregnant mothers, like you have to take the folic acid in your empty stomach, because it will correlate with the HCl, that is hydrochloric acid, that is being secreted from our stomach, and it will cause the good absorption of the folic and iron absorption in the body. Next is right dose. So this becomes a very important when medication at hand are in a large volume or strength than the prescribed order given, or when the unit of measurement in the order is different from that supplied from the pharmacy. So sometimes what happens, the doctor will prescribe only the limited amount, but we will have a more quantity as it is being supplied from the pharmacy. So we have to calculate it properly based on the age, then only we have to administer. Next is right route. An acceptable medication order must specify the route of medication. So the doctor itself, the physician, will give us a prescription in which route we have to administer, whether it has to be administered in intravenous or orally or subcutaneously. So based on the good absorption, the doctor itself will give us the prescription. So based on the doctor's prescription, we have to administer the medication. Next is right to information on drug and client education. So whatever the drug I am going to administer the patient have the right to ask all the information regarding the drug administration. For example, they are asking me regarding what is the drug you are going to administer, sister, what is the function, for what purpose you are administering. So if they are asking such questions to me regarding the drug administration, means as a nurses I have to impart the knowledge regarding the drug administration to the patients. So they have the right to seek the information from the healthcare provider. Next is right to refuse the medications. So the patient has the right. So I have said, that patient have the right to seek the information from the healthcare provider. In the same way, after getting the information from the healthcare provider, the patient have the right to refuse the medications. But even though as a nurses, we are obliged to explain the patient why the drug is being administered, why the drug is being prescribed. If the patient is not taking this medication, what are the complications can the patient face it on? Like that, we have to tell them in a proper way, and we have to make them to realize and understand that for what is the reason for administering this medication. But as per the right, the patient have the right to refuse the medication whatever we are administering. Next is right to assessment. So some medications require specific assessment before administration. So example, checking the vital signs before administering medications like digoxin. The pulse must be checked. So before administering any medication, we have to check the vital signs, and certain medications require the pre-assessment and post-assessment. Next is right to documentation. Documentation should be done after the administering medication and not before. So we have to do properly, we have to do the administration of medication, then only have to further proceed for documentation. Next is right to evaluation. Conduct assessment to ascertain drug action, both desired and side effect. So after the administration of medication, we have to check it for any adverse reaction is being taken place or not. So for example, I am administering the medication IV means if I am seeing any adverse reaction, immediately I have to stop the administration of medication. Next is drug forms. So there are various drugs forms is being available. Example, solid, example tablet and capsule. Liquid, example syrup and eye drops. Semi-solid, example ointment and lotion. So tablet, it is a powdered medication compressed into hard disc or a cylinder. That is, next is capsule, medication covered in a gelatin shell. A gel or jelly, a clear or translucent semi-solid that liquefies when applied to the skin. So when we are applying the, for example, for pain and all, we have the diclofenac gel, no? So when we are applying, it becomes very liquefied. So before it will be like very whitish in gel is gel consistency. So when we are applying, it becomes very liquefying and it gives us a very soothing effect. So that is an example of gel or jelly. Next is lotion. So drug particles is a solution for topical use. Next is lotion. So drug particles is a solution for topical use. So for example, when you are getting any skin infections, the doctor will prescribe you a calamine lotion, no? So for in order to prevent the or provide a soothing effect while having itching. So that is known as one of the example of lotion. Next is ointment. It is a semi-solid preparation containing a drug to be applied externally. Powder, a single or mixture of finely grounded drugs. And for example, candid dusting powder and all is there, no? So it is a medication that is being used to as a for example, it is being used as a medicinal purpose. Next is a solution. Solution can be dissolved in other substances like in water, then we will take it in intake. For example, ORS solution, oral rehydration solution. So it is being mixed with the water, then we take it as a medicinal use. Next is suspension. So finally divided undissolved particles in a liquid medium should be shaken before use. So it will be in a suspension form, mainly when you see the cold medications for the pediatric populations, no, that will be in the suspension form. So we have to shake it, then we have to use it. So these all are the some of the forms of the medication, that is lotion, ointment, powder, solution and suspension. Next is syrup. So medication combined in a water and sugar solution. So syrup we know it is very familiar with it, right? So we get various syrups forms like cough medications or chlorpheniramine maleate syrups like that. Next is suppository and easily melted medications prepared in a firm base such as gelatin that is being inserted into the body, rectum, vagina and urethra. And next is transdermal patch. So when we will be just inserting those patch in our body, and that will give us a medicinal effect. It's all about the principles and forms of medication. If you have any doubt, kindly drop down in the comment box. Kindly like it, share it and subscribe it, the Nursing in Handy channel, and thank you for watching.